Hey folks, it's Dr. Walker from dentalwalker.com. Welcome back to the channel. Today I'm going to talk a little about CoQ10 and the active ingredient Ubiquinol. So again, if you like what we're talking about, go ahead and hit that like button for us so we know that you understand and you like what it is we're talking about and kind of keep this thing going for everyone to see. So CoQ10. CoQ10, again, the active form of that is ubiquinol. So CoQ10 is one of the most important coenzyme in your body. And what you find is that it's highest in certain parts of the body, specifically areas that does a lot of function, a lot of work for you. For example, the kidneys, in your liver, and also in your heart. Now, it's important, for example, in your heart because the heart beats 365 24/7, right? So it needs a lot of energy to do that. It uses a thing called ATP, which sort of the energy that body uses, almost like giving gas to a car, sort of the same process. CoQ10 is that thing that does that for, again, most of those mitochondrial cells in your system, giving you that energy. If you don't have enough of it, for example, you end up with things like heart failure and heart disease and those kind of things. So a lot of people take it just because of that reason. But again, for me and understanding it, it's really an energizer for the body, energizer in the cell, if you would, for the whole system to take place. Now, as you get older, right? As you get older, that level of CoQ10 falls off, typically about age 40. So a lot of folks will say if you're taking CoQ10, after age 40, take the active version of CoQ10, the ubiquinol, because it doesn't convert very well after 40 in terms of CoQ10 to ubiquinol, and B, the body doesn't utilize it as well as it did when you, let's say, 25. So take and again, talk with your doctor about this before you listen to me and so forth. But if you're going to take it after age 40, let's say, jump on the ubiquinol version as opposed to the CoQ10 version of that. And again, it helps with things like mentation and mind and mood and energy and focus. If you don't have enough of it, people tend to feel things like fatigue and sort of just can't focus and can't think and those kind of things. And again, as you get older, that whole level falls off significantly. And so by the time you're 65 years old, you're not a lot of energy and so forth because the body produces a whole lot less of this thing going forward. And again, it's good for cardiovascular health, liver health, muscle energy, those kind of things. Diabetes also, it helps with folks with diabetes and arthritis and joint pain and so forth as well. Now, here is the reason I'm talking about this thing. And I mentioned it several times in tweets that I sent out. Here's the reason I talk about it so much. At the age of, let's say, 50, right, when the CoQ10 levels are falling off, right, the conversion of from CoQ10 to ubiquinol falling off, the amount of it being utilized by the body is less, right? You go to your doc, and the doc says, oh, by the way, your LDL cholesterol is kind of going through the roof, right? I'm sorry. Yes, going through the roof. So then they say to you, okay, you got to take another kind of thing to help the cholesterol get sort of low. So they give you a statin, right? Statin, right, in the same pathway, essentially, HME-CoAce reductase pathway, it also blocks the coenzyme Q pathway, right? So a lot of folks that take a statin will end up saying that, oh my God, I'm so fatigued, I'm so tired, I can't focus, I can't sleep, I can't do anything, right? So you go to your doctor and say, hey doc, by the way, I started this pill 2 weeks ago and now I have muscle aches and pain and whatever else. And so they'll tell you, or some of them, not all of them will tell you this, oh, it's in your head, continue taking your statin, it's crazy, right? You're taking this new pill for, quote, the LDL cholesterol being too high. They're trying to drive it down. How low? Ask them. But you have this sort of a side effect, which is a very common thing, muscle aches and pain and fatigue, all side effects of statins. Why? Because what it does is it really put a chokehold on the thing that gives your body energy. And again, you have less of it as you get older, but now you're taking more of this drug, statin, again, to drop your LDL cholesterol, causing you even more side effects or more side problems, right? So I'm telling you that so you can have a discussion with them to know it's not in your head. It's not just something that happens. When you start taking these pills, it can cause you some problem. And again, fatigue and muscle aches and pain and all those things. Talk with your doctor, let your doctor know, hey, by the way, I started taking this pill a couple weeks ago and my joints and my muscle is just killing me, right? They may suggest to you, give you a supplement called CoQ10 to help with that, right? But that's what they may do. They may not do that because there's an article done several years back to say that there is no known or definite association between taking a statin and muscle ache and pain. But again, the whole pathway, as I said before, in terms of the energy production, CoQ10 energy production, is significantly hampered by statins. So it could be coincidental, right? Or it could be the source of the muscle ache and muscle pain is the new drug you're actually taking, which is statin. And most of you know my take on statins to begin with. I'm not a fan because I'm just not a fan, right? So anyway, tell them that you started taking a statin a couple weeks ago and this is what's happening to you. All right. So some things that you can get, that has a certain amount of CoQ10 in there. For example, for me, pescatarian, so seafood, fatty fish, for example, salmon, herring, and trout has a decent level of CoQ10 in there. But other things like avocado and eggs and fruits like strawberry, nuts like almonds have some degree of CoQ10 in there, but probably not as much as you probably need. So most people probably take between 200 and 500 milligrams of CoQ10 or ubiquinol as they get older, just for that energy thing, energy production and making you feel good and focused and driven and those kind of things. Between 200 and 500 milligrams, again, talk with your doctor to be certain that that's a good number for you. Some of them don't even believe in that whole process, but that's neither here nor there. But CoQ10 is one of the main energy coenzyme that your body has, CoQ10. So just be cognizant of that and know it, and kind of go from there. Side effects, not really a whole lot in terms of maybe some GI upset. Also, people taking Warfarin, for example, can have some difficulty controlling their blood levels and so forth. The doctor actually should know about that part of it. I take mine in the morning, daily, for just for energy. So my energy packs, essentially, not coffee, would be sort of a B12 supplement. A B12 be certain that it's not the cyanocobalamin B12. It is the either adenosine cobalamin or methylcobalamin, the active version of those things, right? That's what I take. So the B12, 2,000 milligrams of that, with a B complex vitamin as well. Make certain also that does not have cyanocobalamin in it. Have the methylcobalamin or the adenosine cobalamin, those two things. And then the other one is CoQ10. Again, because it energizes the system, or ubiquinol, it energizes the system. As you get older, that level falls off. For almost all of us, it falls off. So you got to supplement yourself, or your diet has to be consistent. Again, diet in terms of the seafood and so forth, not a whole lot, but it has some. Not a whole lot. But you probably need a supplement to help you with your energy levels and so forth. As you get, obviously, after age 50 or 60, thereabouts, you may need some more and more. If you have things like heart failure, congestive heart failure, and again, if your heart's not pumping well enough or adequately enough, or doesn't have the energy to pump well enough, you can end up with things backing up a little bit, heart failure, right? So people that have things like heart failure may need a little more CoQ10, again, just for that contractility of the heart. But again, for me, it's an overall energy source, energy pack essentially of the body, energizing your system, helping you focus and driven and go seize the day sort of thing. So the big thing again for me, if you're taking a statin, right, and you have muscle ache and pain, it's not in your head, right? It's not made up. It's not right. It's not any of those things. Some people may tell you, doctors may tell you, oh, it's in your head. It's not. You start taking this thing 2 weeks ago, and now you have this sort of muscle ache and pain and fatigue. It's not in your head. So talk with them. They may suggest a CoQ10 or ubiquinol supplement, or they may not, right? And if they do not, I would have a really strong conversation with them about them being your doctor going forward, because in my mind, they're not taking your best interest at heart. No pun intended. Thanks for listening, Dr. Walker.